2 kids this year, one in Arkansas who survived this, which is very rare with this, but we had one child die of what's called primary amoebic meningoencephalitis, or PAM as we call it. It's an amoeba that has to go up the nose when you dive in the fresh water, and it gets into the sinuses, of course, and then gets into the brain, and of course basically starts destroying brain tissue. It starts to multiply with that. Death rate is virtually 100%, but you have to dive down into water. The water must inject up the nose where you get exposed to this amoeba. And remember, amoebas are more prolific. They're always in fresh water, particularly in the summer months. That's generally when you see this. Now, you mostly see this in the southeast. Now, this happened in Arizona in a nasty pool where kids were diving in that, and they got this disease and died from it. The amoeba is called the Naegleria fowleri. We've had 130 cases. Only about now 3 people have survived it in 30 years. Now, 2 years ago, we had a young lady, 16-year-olds, and you know, kids who get this are the epitome of health, which is kind of interesting. Of course, they're healthy enough to dive in the water, of course. And she was actually diving in with 6 other teenagers, but the 1st of August, she was exposed, and then a few days later starts having all the signs and symptoms as you see here. Now, Arnold Palmer Hospital in Orlando probably has treated this more than any hospital in the United States. Now, how many of you been to Orlando? Any of you been to it? And you know, I guess you flew there. You know, maybe you did the Disney thing. And if you come out of the airport, you'll go left, and then you get on what's called our beach line, and when you head left to go to Disney or Universal, you'll see a lake to your left as you're heading towards Disney, and you may see these ramps and ski stuff. That's where they train kids to do trick skiing at SeaWorld and all these other theme parks. There's been 3 cases of this in that one lake, because if you're skiing and you hit that water going 30 miles an hour, zhang, something's going to get plugged up, and it must go through the nose. Must go through the nose, of course, with this. By the way, we sent the specimen to CDC. It was confirmed by PCR. Now, how you treat this is intrathecally. And by the way, the fungal meningitis, many times you have to treat that intrathecally, where you inject like amphotericin B, fluoroconazole, azithromycin, and rifampin. Now, the one case that survived and the one that didn't in Florida, they gave a breast cancer medication called metaphyseline. And the CDC will offer that now if there is such a case. Now, I think this is very rare here. Has happened in Minnesota, though. Has happened there, too. Okay, and these are the cases. This is the area she was jumping into, and that's very, very stagnant water, which accentuates this. And by the way, the air temperature was 98 degrees when she was jumping in. The water temperature, as best we could tell, was 89 degrees. So it was a perfect storm for this.